patients. Alright, when we help our patients go up and down curves, this is the process to do so. So obviously they're going to have their brakes on. There you go. Alright, we're going to push them up to the curb. Now you have to be mindful of their leg rest. So for example, hers are going to hit the curb, so I can't really go any further. So what I do here is I'm going to step on the back part that sticks out the back and tip my patient back. And so I want to tell them I'm going to tip you back. I'm going to push them forward until the back wheels hit the curb. From here, I'm going to use my hip, lean down and in, bending my knees, straighten up to lift up. So I'm not just relying on my arms, I'm using my legs as well. And then I would go forward on the sidewalk or whatever it is that I'm going forward on. When I'm coming off a curb, I would never want to put the person off forward because the wheelchair will tip. So in order to come off the curb, I would go backwards down. So you're going to feel me tip you backwards again. So as I go to come down, again, I'm going to put my hip into the wheelchair, slowly lower them down. Oops, I didn't make this. Tip them back a little bit further so that I can clear the wheels and the leg rest. Then I can put my foot on the back again to slowly lower them down. And so anytime I need to go up or down a curb, this is how I would do it. So again, I'm going to come up to the curb. All right, I'm going to tip you backwards. And I just need to tip her back far enough just to be able to clear the casters and the leg rests. All right, we're going to go up onto the curb, do what I need to do. In order to come back, put my hip in, slowly lower backwards, tip just a little bit to clear the wheels and the leg rest, come back, use my foot to help slowly lower. Any questions with curves? Okay, the next skill you're going to practice, use one door, is teaching your patient to go out a door. So I'm going to have you propel up to the door here. And so we're just going to pretend like this is the one door. If the door is opening towards the individual, what you'll have them do is come up close to the door. You're going to reach forward, grab the door, and as you pull it towards you, you're going to block it with your chair. And then use both your hands there because you have it blocked. Okay. Watch your fingers as you push yourself through it. Go ahead and turn around, and I'm going to have you do that on your own. So pretend like this is a wall here. There's a wall there, so you can't get that close. Go backwards with your chair as you pull the chair backwards. Or the door backwards, I'm sorry. Grab the door. And your chair stays in front of it. And propel yourself through. Good. So that's if it's swinging towards you. Go ahead and turn around. If it swings away from you, and if it has one of those bars that you have to push, you'll propel up to the door. And if you have to push the bar, so go ahead and pretend like you have to release the door, push forward with your wheelchair as you initially push. And then you could use both your hands if you're able to, depending on the weight of the door, or just one hand. Turn around and push the door. And so depending on the weight of the door, the leg rest, so for example, far from her body, which makes it a little bit harder to manage doorways versus, for instance, these leg rests, which are underneath the body. So that goes into account. The other things that we need to take into consideration whenever we're thinking about wheelchair propulsion, other than just going on flat surfaces, is managing elevators. And so whenever you do elevator management, typically what you'll do is if you are pushing the wheelchair, you will turn the patient around, and when the elevator doors open to go into the elevator, you will pull them in backwards. That way then when the doors open, you can just walk out and go forward. And you should encourage your patients when they're managing their wheelchair independently to do the same. So go in, and they can propel in forward if they want, but just turn around while the elevator's moving. So when the doors open, that they can push just straight out. That decreases the risk that the doors will start to close while they're in the middle of them. The other skill that we're going to practice, which I have to set it up, is the ramp. So let me set that up and then we'll practice that real quick.